Hi, I'm Louise Lowe, one of the librarians at Ottenheimer Library. Today I want to talk to you about your nursing research class and specifically Module 1 and 2. I know that you've already turned that assignment in, but I just really felt like I wanted to come in and just provide you with a little bit more detail and a little bit more clarity, and hopefully that will make things a little bit easier for you as you head into Module 3 and so forth. After reviewing the assignment, what I want to do is discuss information need and why it matters for your research. I want to identify or help you identify sources for background and foreground questions. And I want you to be able to construct a clinical question and search strategy using PICO. Before we talk about evidence-based practices and what it means, I want to spend a few moments talking about information need. Before you dive into any research project, you need to first understand your assignment. This may require that you read the syllabus, the assignment, and all associated content. You may need to do this more than once. And this is very important, and I'm going to tell you why. When you conduct research for your class, you must consider your assignment too, and not just your research topic. The requirements for your assignment is part of your information need. So information need is basically the information you need to answer a question or to fill in a gap in your knowledge. And so while you're conducting research for your class, you also need to consider the assignment as part of your information need. So here's an example. Looking for information on obesity and surgical procedures is a lot different from looking for qualitative research published in the last 5 years on obesity and surgical procedures. So that's why it's so important for you to understand the variables or the assignments that your professor outlines for you and not just the topic. And so finally, I want to talk about evidence-based practice. This will probably be more of a review than anything else, but I just felt like I needed to put this in here to draw everything or bring everything together. So basically what evidence-based medicine or practice is, it is a systematic approach to clinical problem solving by integrating the best available research evidence with clinical expertise and patient values. And where all those things, three things meet, is called evidence-based medicine or evidence-based practices. Foreground questions typically ask about a clinical concern for a specific patient or particular population, drug, or two treatments. And it's very specific, and it usually takes or it requires research articles. So background questions ask for general knowledge. Typically, these types of questions would start with who, what, where, when, how, and why about a disorder, test, or treatment, or some other aspect of healthcare. And what these do is that they provide a basis for formulating foreground questions. And an example of a background question would be, what causes migraines? So background questions generally ask um, for general knowledge, and they're best answered by using a textbook, or you can find information on professional organizations or through clinical practice tools. For your assignment, you've been asked to provide statistics and guidelines. The statistics help demonstrate the scope of your problem In other words, how big is your problem and how many are affected by it? Your professor provided an excellent place to go for general statistics. The CDC is usually the first place I go for general background and statistics. Most of us understand what the CDC does since we rely on them for current information about the coronavirus. For worldwide statistics, you could view WHO, the World Health Organization. Again, you've probably seen these two organizations in the news lately due to COVID-19. There are other places you can look. Again, let's remember your information need. If your problem or your population is local or whether it's worldwide. Is your target population in Little Rock or nationwide? These things or these factors will contribute to where you look for information. Asking these types of questions are part of the research process. Research is not linear, and sometimes you need to revisit and revise. Research just doesn't begin when you start searching for information or conducting a study. Asking questions like this is part of the research process. For foreground clinical questions, they are best answered by consulting medical or health databases. The ones that you will most likely use will be CNOL and Medline. And Medline is available through Ovid and PubMed. And so at UALR, we will have Medline and PubMed both listed for you. The thing I want to tell you, PubMed is available publicly. So you can access that. Anyone can access PubMed, but it's very important that you access our databases through the library's website. This way, you will have access to all the full text content that we purchase and provide for you. I'm not spending very much time on the foreground questions because I think that will come up later when we go over PICO. But to answer those types of questions, you go to databases in order to find research articles. Before we go into the PICO and formulating a clinical foreground question, I want to jump back to guidelines. And your professor again has given you an example of where you can find guidelines. You may be able to find guidelines and standards of care through other professional organizations such as the American Heart Association, the National Cancer Institute, American Psychiatric Association, or American Academy of Pediatrics. Most of these sites post evidence-based medicine reviews or practice guidelines. You just have to go to their particular websites to find those. And it's also another point to make or to emphasize your information need. If you are looking for something on pediatrics, obviously you would go to the pediatric site. If you're looking something about heart or heart disease, maybe you would want to look at the American Heart Association. So again, throughout your whole research process, you're always going back to your information need and answering that question, making sure that the information that you seek is actually focused in on that particular question. And so with that, I want to lead into your foreground clinical question because that's where we're headed. PICO is a template or a model that allows you to define your research. The PICO model is a helpful tool that will assist you in organizing and focusing your question, your foreground question, into a searchable query. If you divide your question based on the PICO elements, it will help you identify search terms, concepts to use in your search for relevant literature. A well-built clinical foreground question should have 4 components. P for patient or population or problem. So in other words, what are the most important characteristics of the patient and their health status? An intervention or exposure? What main intervention are you considering? Is it a medical, surgical, or preventive type intervention? Is it a comparison? Sometimes a comparison is not always part of PICO, but if it is, what are the alternative benchmarks or gold standards being considered, if any? And then the outcome. What is the estimated likelihood of a clinical outcome attributable to a specific disease, condition, or injury? So you can see that PICO is very important, and if you can outline your clinical question and outline it using the PICO method, then that is not only going to help you formulate a clear and precise question, but it's also going to provide the groundwork for you to have great search terms when you're ready to search CNOL or Medline or PubMed for the types of articles that you need. Knowing the type of foreground question can help you select the best study design to answer your question. You always want to look for the study design that will yield you the highest level of evidence. This pyramid shows a correlation between the type of study design and your question type. What I am going to do is I'm going to actually include 2 videos at the end of this recording, and both of those videos will go over your clinical question and study design and how to correlate or find information that correlates properly, but also it's going to go in further detail into PICO. So when we finish this video, what I'll do is I'll create a playlist in YouTube to 2 other videos, and so I want you to actually read or look through those or listen to those, and those will go into greater detail about the types of study and the types of questions and how they match, and also about how to really flesh out PICO and create a search strategy. I wish I had more time to really go into everything with you guys in this brief overview. There's so much more I feel like I need to share with you. But what I will do is I'm going to leave the contact information for the library. Most of you already have that. Your professor has provided that information, and we are very thankful for her for doing that. But I also want to make sure that you view the library guide that we have provided for you. That guide has a PICO and search strategy worksheet that will help guide you through the whole process. It also provides search examples for CNOL and PubMed for locating different types of articles. So if you wanted a qualitative article or a quantitative article, that library guide will actually go through that. And what I will do is I'm going to post this video on YouTube, and I'll put the link to the library guide, although I think you already have it, but I'll go ahead and put that link in the description box. And like I was saying in the previous slide, I'm going to create a playlist of other videos that were created by other librarians, not necessarily at Oppenheimer at UA Little Rock, but they're very good, and I think I selected them because they did a very good job of explaining evidence-based practice, PICO, and providing example searches. So take some time to actually look through those, and I think that will give you the foundation for the remaining, for the upcoming modules that you will have. I will take a look and see if there's some more content that I can provide for you guys, and hopefully I can get that to you a lot quicker than I did this. But if you have any questions, please don't hesitate to contact any of the librarians. We are here to help you, and I want you to have a good day and a great semester. Talk to you soon. Bye.